Hello and welcome to the Desiree Show. Today we've got Dr. Wayne Aldredge joining us in the studio.
Thank you for having me.
Thank you for coming. Now, Dr. Aldredge is a periodontist and implant specialist who owns private practices in both Homedale and Nutley, New Jersey. He is a board certified by the American Board of Periodontology and is a clinical assistant professor in the Department of Periodontics and Dental Implantology at Stony Brook University. He's also an attending faculty member at Newark Beth Israel Hospital and Monmouth Medical Center and teaches a dental hygiene program at Middlesex Community College. Oh, that's not it. Prior to opening his private practice, Dr. Aldredge practiced general dentistry as an Army captain in the United States Military Academy at West Point. Today, he's going to discuss with us the roles and responsibilities of dental hygienists in a specialty practice like his own, and how they may differ from hygienists working in a general dentistry office. He'll also provide his thoughts on the ever-increasing relevance of the periosystemic link and how this will certainly change aspects of dentistry going forward. So, Dr. Aldredge, again, welcome to the show. So happy to have you. Now, I'd like to get into the topic about what it is like being a dental hygienist in a perio office rather than just a general dentistry one. What's the difference?
Well, I think sometimes when we think of a specialty practice, we think that there's some special bells or whistles going on in there. When you come out of a dental hygiene program, we have to remember that you're trained to the minimal level of competence. So when you come out, the first place you get your job sometimes helps you and guides you to what type of level you'll practice at. Because ultimately the goal of doing hygienist or periodontal therapy is to reduce inflammation, make sure the patient keeps their teeth, and everybody wants to smile and chew on it for a lifetime.
Yes.
So when you come into that first office, you may be trained to the level of doing scaling and root planing in 5mm probing depths. So a lot of times when we think of gum disease, we think of how deep is the pocket? How far does the ruler go down into my gums? How much is the bone melted away? So you may go for additional training down the road with continuing education like we all do. But ultimately, the proper way of thinking about therapy for a patient is when we do scaling and root planing, regardless if it's a 5mm pocket, a 7mm, or a 10mm, is a month later we get that patient back in and we say, how did you respond? You don't hear somebody going in to have open heart surgery and they send you home and you never go back to the doctor.
Right.
There's follow-up appointments. So when you go into that general dentistry office and you treat that patient, you want to make sure that you're following up with them afterwards. So I don't think that there's much difference overall in treating the patient. But if we think about the differences between a general dentist office and a periodontal office, that's all we do. That's all a periodontist does. We do nothing but work on the foundation of the house. All we do is clean the house, clean the foundation, make sure that the general dentist can make new crowns or bridges or put fillings in there. So I guess you could consider that one of the big differences.
Right.
We don't have children for the most part. We're not just doing prophies. For the most part, patients coming in to see us have moderate to advanced disease and need that next level of therapy.
They've been referred.
They've been referred over. Unfortunately, patients don't just go to the periodontist. They go to the general dentist, which is the gatekeeper, and they do an evaluation of that patient to sort of see how bad the disease is. You know, do I need to see a specialist? Just like when you go to see your internal medicine doc.
Right.
Well, my blood pressure is this over this. Am I comfortable treating it, or do I refer to the cardiologist? And that's sort of the same type of triaging that goes on in dentistry is the same that goes on in medicine.
Gotcha. So now when dental hygienists are coming fresh out of school, they're pretty much all equal. It's you learn by doing in the practice that you go to.
Absolutely. And I think of hygiene and general dentistry as a co-management. Don't think that, well, we're going to send them to the periodontist or we're going to send you for advanced therapy. But you're still part of the team. Because when we get done with whatever therapy we're going to do, we still refer you back to your general dentist. So we want to make sure the roof doesn't have any leaks. Do you have any cavities? Is there any root canals? We have to co-manage that patient.
Right.
Not all the patients, just the ones who need that specialty level care. And I think I love the word co-management because that's really the ideal level of healthcare is the same thing in dentistry. Our goals are to maintain that patient in health for a lifetime.
Right. So co-management, give us a little bit more of a broad explanation of that.
Co-management. Somebody comes into the general dentist office. Okay. Mrs. Jones, we've done this level of therapy. Your bone is still melting away. In essence, it's not really just gum disease. We say gum disease, but you could smile right now and your gums look great. It's the bone underneath that melts away. You don't see that happening. So you then go from that general dentist is going to say, Mrs. Jones, your bone is melting away. We now have to send you to the specialist for some advanced therapy. We can grow bone back. Yeah, there's regenerative procedures where we can grow bone and do guided tissue regeneration. Or we can do just some periodontal therapy where we make sure all the tartar's off the roots. So it's now healthy for a long time. Because if the dentist is going to put a bridge, is everybody familiar with what a bridge is?
Yes, I think so.
A bridge is caps on your teeth that are joined together where you're missing some teeth in between.
Right.
Well, those teeth on the side that are going to hold that bridge have to be strong.
Yeah, they need a foundation.
So that's what we are. We're the foundation people. We make things strong and healthy so that new bridge you're going to invest in will last a lifetime, hopefully.
You're the out of sight, out of mind. You know what I mean? Like, people don't see it, so they don't think there's a problem.
Well, I'll give you a great example of that. People say, they come in all the time, I don't have gum disease, my gums don't bleed. I go, well, do you smoke? Yes, they smoke. Smokers are 7 times as likely to have severe gum disease compared to a non-smoker.
Wow.
So, but you're always told if your gums bleed, you have gum disease. Well, your gums don't bleed if you're a smoker, or they bleed a lot less. But because the disease goes so much quicker in you, the bone melts away faster. So I would say 60% of my practice is smokers. And that can kind of lead into other systemic problems. And that goes to co-management. I had a patient once who smoked three packs of cigarettes a day.
Wow.
And I couldn't get her all the way down to 0, but I got her down to 1. And at the end of the year, she saved enough money to go on a cruise. But seriously, no, it's a true story. And so we don't just think of making you healthy in your mouth. We want your whole body healthy.
Right.
Which I guess sort of leads into your question before about the periosystemic link. And if we think about gum disease, and this is how I'll tell you how I present it to a patient. We're going to put a ruler between your tooth and gums.
I'll pretend I'm in the chair.
As we have you back in the chair, I'm going to take this little ruler, and I show them, I go, we're going to put it between your tooth and gums. And just show it down here. We're going to slide it in there. It's going to give me an idea of where the bone is underneath the gums, because really we want to know where the bone levels are. I say, and I go, are you familiar with tartar? Do anybody know what tartar is? Tartar is that hard stuff that builds up on your gums. When that tartar gets below the gum lines, it acts like a housing project for those bad bacteria. Causes your bone to melt away. I put it to them this way. If you brush your teeth and blood comes out, well, conversely, the bacteria and the byproducts get into your bloodstream. And then it affects things in different places. And if we think about what heart disease is or what causes it, it's an inflammatory process. Well, the gum disease is inflammation of your gums. They bleed, they're red, they're swollen. Sometimes your teeth move. And when they move, that's in the most advanced stages of gum disease. So we try and catch it before your teeth start to move.
Right. They want out.
They want, well, in essence, your body's pushing them out.
Yeah.
Your body doesn't like the tartar or the housing projects on the roots of the teeth. Your body just keeps moving away from it.
It's like an infection.
Right.
You know.
So the infection's causing the bone to melt away. The teeth become loose, and we take them out. And we can replace them in most cases with dental implants.
Right.
So there are options for people, but there's also been research into preterm low birth weight babies, or preemies. Preemies, 75% of the causes of low birth weight babies are known. So we know all of those 75%. 25% of the time when you have a preemie, we don't know why. Well, there's been some studies that link the inflammation in your mouth with its byproducts that get into your bloodstream, having certain individuals having an increased risk of having a low birth weight baby.
That is unbelievable.
So, you know, it's when you think that you can affect the health of a baby.
Right.
You know, just by doing dentistry, it's sort of heartwarming. It makes
So
you
even women who are thinking about becoming pregnant should get their house in order.
absolutely get your
You know?
gums checked, make sure everything's fine. And one of the, besides smoking and the low birth weight, I mean, there's diabetes. The interesting part about diabetes is if you're a poorly controlled diabetic, your gum disease is that much worse. If you're if your gum disease is well controlled, your diabetes is better. That's a proven link. So if you have diabetes, be it type 1 or type 2, you're more susceptible to gum disease. So these are all part of that periosystemic link, we call it.
Right.
You know,
Which is becoming more popular amongst the industry, but maybe not so much getting out there. You know, people need to know that if they're not treating their mouth with the respect it needs,
sure.
they're going to screw up a lot more than just their teeth and their smile.
Well, absolutely. It's you're not just gum healthy, your heart healthy, your body healthy. It's overall wellness. So when we think of treating the mouth these days, we think of wellness. We don't think of, okay, you have this problem, let me just put some spackle on that hole in the wall.
Right.
How do we make you healthy so you don't have any more disease or any more problems in the future? And I think that's the way to go.
Yeah. I mean, periodontal disease is an active infection and really needs to be treated as such.
Oh, absolutely. Even the Surgeon General said in 2001 in his report to the president, he said, if you don't have oral health, you are not a healthy individual.
That's it. We can just end it right there. Because seriously, that essentially sums up your entire mission. But I need to tell you, your analogies that you use to explain periodontal disease, the house, everything, it's such a great way to explain this to patients. And I think that all of our viewers are really going to take something away, and you might have to, trademark some of those things.
Well, thank you very much. It's my pleasure to be here.
Absolutely. Thank you so much. That's all the time we have for this Desiree Show. Tune in next time for another exciting adventure.